Well, thanks again for being with us for this very special awards luncheon. And we're in a few minutes going to recognize this year's winners, but also, before we did that, it was important for us to recognize past winners who are with us. And I know of two in particular, and if there's anybody else after I announce those two, please let us know. I know that Dr. Sean Stinson is here with us. If you could stand, Sean, from Palmetto Health. And Jan, where are you, Jan? Sean received the award for Healthcare Executive and Jan for Patient Advocate. Are there any other folks here in the room that received the Lewis Blackman Award previously? Oh, there's this wonderful lady from McLeod Health that I've met a couple times. You just won the award so long ago. I have a hard time remembering what happened last week. Donna Isgett, who is over all the quality and clinical effectiveness programs at McLeod Health, was a healthcare executive. Was there anybody else I missed? Well, I will say that all of you are champions, the way I see it, because every person in this room I know is involved at some level or another making patient care better or safer. And especially for these award winners, one of the keys here is that they're not only making a difference within their own organization, but are making a difference that we're seeing across the state and in some cases across the nation. So with that said, I want to go ahead and recognize and invite our representatives from each of our symposium sponsors to come up, who are sponsors also of this Lewis Blackman Patient Safety Champion Award. From Blue Cross Blue Shield of South Carolina, Dr. Laura Long. From Health Sciences South Carolina, Kelly, you're representing Dr. Moskowitz. Much more attractive than Dr. Moskowitz, let me assure you. From PHTS, is Brian Toussaint here? Yes, he is. And from SCHA, the Honorable J. Thornton Kirby. And then the person who's going to take it over from here is Helen Haskell with Mothers Against Medical Errors, the mother of Lewis Blackman, and who has been an unbelievable champion, not just in this state, but nationally and internationally. In fact, she just came back from Paris with Maureen. And I was telling them, boy, I wish I could have been in Paris with you. And of course, Maureen showed the slide this morning. She said, you were there with me. And I said, it didn't feel like it. I was probably, when you were doing that, I was sitting in some hotel room in Columbia, South Carolina. It did not feel like being in Paris. I'm sorry. But I still like Columbia. It's a nice city, yeah. But I want to go ahead and recognize Helen, who will take it from here and, again, announce this year's award winners. And then our sponsors will have a chance to congratulate them. And I will make sure I get the award over to you. This is the correct award for each recipient. Helen.
I always have to adjust the microphone. Thank you, Rick. And it is absolutely my pleasure to announce the 2012 Lewis Blackman Award winners. Each of you, when I call your name, if you would please come up to receive your award. This year's Advocacy Award goes to Dixie Roberts, who is the retired Director of Healthcare-Associated Infections at DHEC. I just want to say a few words about Dixie. Dixie was a public health nurse. She worked for many years at DHEC, but she's really getting this award for her work with the Hospital Infection Disclosure Act, HIDA, which was where I met her. She managed a rather large committee of, HIDA was unique in that it had every interest group represented. So we had a committee of about 40 people who were enthusiastic and contentious, and Dixie sort of shepherded us through all of that, so that South Carolina, which was one of the early adopters of a hospital infection disclosure, became sort of a model for other states, and a lot of that had to do with Dixie's insistence on validation, which a lot of other states didn't do and were criticized for. And Dixie later became the representative to CDC and in charge of the federal plan. So Dixie retired recently, and we will miss her. But thank you, Dixie, for all you have done, and congratulations. Oh. Our Caregiver Award goes to Dr. Elizabeth Mack, the Director of Quality and Pediatric Critical Care at Palmetto Health. I'll just say a few words about Dr. Mack. She leads Palmetto Health Children's Hospital's quality initiative to prevent central line bloodstream infections, CLABSIs, and to prevent medical errors. The Palmetto Children's Hospital, under her leadership, has joined the National Association of Children's Hospitals, and oh my goodness, this is a long name, and Related Institutions Quality Transformation Network, and collaborates with more than 80 children's hospitals nationwide to improve quality, reduce medical errors. She initiated and led the review of pediatric code processes at Palmetto Health Children's, launched an initiative to address patient handoffs, and developed an internal bi-monthly publication called Quality News. And she established a system to recognize staff for filing occurrence reports and created a pediatric unit dashboard to display each unit's total of consecutive infection-free days. She actively involves patient families in the effort to prevent medical errors and infection, and has developed an in-room calendar to show patients which treatment their child is scheduled to receive. Her passion and energy have truly transformed the culture of patient safety at Palmetto Children's. Thank you, Dr. Mack. And our Healthcare Executive Award goes to Dr. Michael Rose, the Vice President for Surgical Services at McLeod Regional Medical Center. So Dr. Rose is both a clinician and a healthcare executive. He provides direct patient care as a practicing anesthesiologist. He's a member of the McLeod Health Board of Trustees, and he's chairman of the Safe Surgery 2015 South Carolina leadership team. Dr. Rose manages the surgery decision at McLeod and directs the Bloodless Medicine and Surgery Program. He's been a member of the Medical Executive Committee and served terms as a medical staff leader, including Chief of Staff. He has led redesign work for the organization's Quality and Safety Program and earned bronze certification for lean improvements. He also chairs the System Board Committee on Medical Staff Transformation and Physician Development. He introduced the Safe Surgery Checklist, which you all heard about this morning, every patient, every time at McLeod Regional Medical Center. He's tracked progress, encouraged participation, and guided cultural change. And through his commitment, he's had a direct and crucial impact on the quality and safety of patient care at McLeod. Thank you, Michael. Now, the last award is one that is especially meaningful to me. This is our Lewis Blackman Student Champion Award, and this actually is a Mothers Against Medical Error Award that we initiated last year. So the second winner of the Lewis Blackman Student Champion Award is Elliot Turner, PharmD. I will say Elliot has proven himself already to be an outstanding leader. I believe you're in your residency now. But among his many accomplishments, even at this young age, he served as president of the American Pharmacists Association Academy of Student Pharmacists. He was class president for USC Student Government Association for 4 years. And in 2011 was elected for the Milan Institute of Pharmacy Excellence in Pharmacy Award. He has long been a champion of patient safety and has worked to bring education to students across Columbia. In 2009, he became a founder of the USC chapter of the IHA Open School and later served as that chapter's vice president. He was an indispensable member of the leadership team. His efforts helped garner strong support and involvement from the USC College of Pharmacy. He challenged limits for the Open School chapter and helped to engage other student groups. In his work as a pharmacy resident, Elliot strives to improve the protections provided to patients through the Palmetto Health System. We are lucky to have such a dedicated and inspiring student champion. Thank you, Elliot.